Hello and welcome to the APT Academy of Oncology Student and New Professional Subcommittee's Diagnoses Downloads. Thanks for tuning in to this month's topic of gynecological cancers. We will be diving into the various types of gynecological cancer, typical treatments, clinical implications, and of course the physical therapist's role throughout the continuum of this care. Gynecological cancers can arise from anywhere in the female reproductive tract, including the uterus, ovaries, vulva, vagina, fallopian tubes, or the peritoneum. This presentation will focus on uterine, ovarian, endometrial, and cervical cancer. Endometrial cancers are most commonly adenocarcinomas or endometrial cancers which start in the endometrial gland cells. Endometrial cancer will often present with abnormal uterine bleeding in postmenopausal women. Purulent vaginal discharge may also be possible due to the formation of an abscess called a pyometra. Ovarian cancer can be diagnosed as malignant epithelial carcinoma, a germ cell tumor, or a stromal tumor, with the majority, 85%, of diagnoses being malignant epithelial carcinomas. Cervical cancers are usually either squamous cell carcinoma, which accounts for 70% of the diagnoses, developing at the transition zone of the endocervix and exocervix, or they can be adenocarcinomas, which are usually found in the endocervix. Cervical cancer commonly presents with bleeding after sexual intercourse or intermenstrual bleeding. In advanced stage cervical cancer, signs and symptoms may be foul-smelling vaginal discharge, pelvic pain, or renal failure due to the obstruction of the urinary tract. Cervical cancer has a very strong relationship with human papillomavirus, HPV. Oral contraceptive use of 5 years or greater also increases the risk of developing cervical cancer, though the risk declines at cessation of use. Uterine cancer starts in the muscle and supporting tissues or sarcoma of the uterus and are not nearly as common as endometrial or cervical cancer. Uterine cancers may present with abnormal vaginal bleeding or a palpable mass. Now let's talk about treatments. For endometrial cancers, regardless of the stage, the initial treatment is surgical staging. This involves the removal of the uterus, cervix, adnexa, and pelvic and para-aortic lymph node tissues. Depending on the stage of the cancer, patients may be offered adjuvant vaginal vault radiation therapy, vaginal brachytherapy, or whole pelvic radiation therapy, with or without concurrent chemotherapy. As with endometrial cancer, surgical staging is the first step with all stages of ovarian cancer. Adjuvant chemotherapy is recommended for all stages except for stage 1A. Individuals with stage 3 to 4 disease undergo cytoreductive surgery to debulk and reduce tumor burden. With late-stage ovarian cancer, it is sometimes difficult or not possible to remove the entire tumor completely. Patients will then undergo adjuvant systemic therapy and may undergo further cytoreductive surgery granted the tumor responds to the systemic therapy. Treatment of stage 1A1 cervical cancer is dependent upon whether the individual is attempting to preserve fertility. A cone biopsy is performed to preserve fertility, while a hysterectomy is performed if not. For stages 1A2 to 2A, surgery is the predominant option, followed by adjuvant concurrent chemoradiation for high-risk patients. Radical hysterectomy has shown to have better quality of life outcomes compared to radiation therapy, with similar survival outcomes. With stage 2B to 4B, standard treatment is concurrent chemoradiation. For uterine sarcomas, hysterectomy with a bilateral salpingo-oophorectomy or systemic therapy is utilized. Now let's dive into the clinical implications. Ovarian cancer unfortunately has non-specific signs and symptoms which may lead to a later stage diagnosis. Abdominal pain, discomfort, bloating, and cramping are symptoms that individuals may report that can be associated with various other disease. More specific signs and symptoms can be menstrual irregularity, unintended weight loss, abdominal distension, and/or pleural effusion. The CDC's Not Just Words video describes the importance of knowing common signs and symptoms of gynecological cancer, including bloating for no good reason, pelvic pain or pressure that doesn't go away, feeling too full too fast even when you've just eaten a little, and unusual bleeding or spotting. Educating your patients on these common symptoms can empower them with knowledge and encourage them to be mindful of their body and any changes that might occur. Along with symptoms that occur with gynecological cancer, there are also long-term side effects of cancer and its treatment, not limited to fatigue, neuropathy, lymphedema, cognitive dysfunction, sexual health concerns, and menopausal symptoms, many of which can be addressed with the physical therapy plan of care. Now let's discuss the physical therapist's role throughout this process. The physical therapist participates on the oncology team by assessing, screening, intervening, and lastly, educating. Assess a patient's risk for gynecological cancer through your comprehensive initial examination. Screen for common and specific signs and symptoms of gynecological cancers is essential for the early detection of various forms of this category of cancers. As physical therapists, we are equipped to treat the impairments that often accompany oncological treatments and assist our patients in maintaining their optimal level of function throughout their cancer course. We can treat various long-term physical side effects of gynecological cancer, including fatigue, neuropathy, lymphedema, cognitive dysfunction, muscle weakness, loss of functional ability, and of course, sexual health concerns. While the Pap test is used to screen for cervical cancer, and there is a vaccine for this form of cancer, we should encourage our patients to speak with their oncologist on how to be screened for other forms of gynecological cancer. Resources for therapists and patients can be found from the Foundation for Women's Cancer and the CDC. A referral to a pelvic health physical therapist may also be warranted to address a patient's concerns during treatment and into survivorship. So what are the takeaways from this presentation? One, physical therapists can aid in the detection of gynecological cancers with an appropriate history and subjective from their initial examination. Two, regularly obtaining a thorough history and review of systems with a patient at risk of gynecological cancers is essential. Three, we can mitigate long-term physical side effects of gynecological cancer and its treatment throughout the continuum of their cancer course. And lastly, we can investigate resources or refer to a pelvic health physical therapist to assist in the maintenance of sexual health throughout treatment and into survivorship for these patients. The resources of information for this presentation are included for you here. Thank you so much for tuning in to this month's topic of gynecological cancers provided to you by the APTA Academy of Oncology Student and New Professional Subcommittee, and we hope to see you again for our next diagnosis download.